Record. So, good evening. My name is Vishal, and today I'm going to do a poster presentation for the topic anatomy of ears. So, first, there are we can see a diagram of ear, and it is divided into three different sections, which is the external ear, the middle ear, and the inner ear. So, in external ear is a funnel for conducting airborne vibration to the tympanic membrane, and it contains urethra, which is the pinna, and external acoustic meatus, which is the ear canal, and also tympanic membrane, which is the eardrum. So it also contains a stiff guard hairs that will be protecting the outer canal of the ear, and also they contains cerebrous and sebaceous gland to release secretion mixed with dead skin cells to form earwax, and it is a form of protection from microbes and um, insects. So the main function of this external ear is to catch the sound and transfer it into the ear canals to reach the eardrum. So secondly, we'll be looking at middle ears. So in middle ears, it is located in the tympanic cavity of the temporal bone. It contains three small bones, which is auditory ossicles, and they are malleus, incus, and stapes. This Y-like structure is stapes. So what is the main function of these three bones is they starts to vibrate, or they starts to have a motion while receiving the sound from the external ear. So it also contains two smallest skeletal muscle, which is stapedius and tensor tympani. And next, we'll be seeing the inner ear. So in inner ear, there are two different structures which are bonded together. The first structure is the bony labyrinth structure in a form of maze, like a passageway of temporal bone in the inner ears. So it contains endolymph. This endolymph is a intracellular fluid which helps to transfer the vibration into signals that will be sent to the brain. And we also have the membranous labyrinth structure that is made like a fleshy tube system at the inner ears. So there is a perilymph fluid which is in between bony labyrinth and membranous labyrinth structure, which are also known as cerebrospinal fluid. And the main function of these both structures is to send to receive signal after from the vibration of the bones and turn it into a signal and will be sent to brains. So these are the three section of brain. Now we will talk about diseases based on these three structures. So the first disease happens in inner ears. So this disease is called acoustic neuroma, also known as a slow-growing non-cancerous tumor that develops in the main nerve leading from the inner ear to the brain. So in this diagram, this yellow structure is also called acoustic neuroma, and the symptoms of this disease is hearing loss, unsteadiness, dizzy, and facial numbness. So this is a slow growing tumor, so it will take a long time to actually show the symptoms. Um, and then there is the treatment for this disease, which is regular monitoring and radiational therapy with the usage of X-rays to kill the growth, and also surgical removal. Next is a disease happens in middle years, which is also known as acute otitis media, and in a short form it also called as AOM. So it is an infection occurs in the air-filled space behind the eardrum that contains the tiny vibrating bones of the ears. This disease is very common among children than adults. So when this infection happens, our eardrum tends to inflammate, and the symptoms we can see in kids and adults is ear pain, fluid leakage from the ears, and trouble in hearing. Young kids also uh, will have fever and headache due to this condition, and the treatment for this disease is regular monitoring and consumption of antibiotics. So the last disease is known as external auditory canal atresia. This happens in our outer ears, which is the incomplete development of our external ear and or wrongly developed outer ears. So as we can see, there are 4 different type of incomplete development, and this they don't have symptoms actually, but this happens at our birth itself, where kids born with undeveloped ears, or while they're growing, the outer ears have lacking of development. So how to treat this condition? This condition can be treated with surgical reconstruction of the ears, and these are the relatable pictures, and these are the names and the labeling of our external ear. These are the labeling of middle and inner ears, and also this um, device we can see in this picture is also called as octoscope. This device is used to see what is inside our ears when we are having some hearing problems, and it also used by medical professions and doctors. So there are also 4 different causes of ear pain that are very common in our society, which is sinus. So excessive sinus in our facial might cause ear pain. Dental problems might cause ear pain as well. Ear skin problems like psoriasis can cause ear pain. And finally, earwax blockage. Earwax blockage mostly happens due to objects that is not supposed to be in our ears will be stuck inside, and earwax in the form of wall they will be blocked. So that is why earwax blockage happens. So I got most of this information from these websites as a reference. So that's all from me. Thank you.